At least it wasn't back. Hey, good afternoon, everybody. This is Anna Sothen here with RVA Connected on ESPN Richmond 106.1 FM on the Mike King Biz Show. And I have Dr. Allred with me. And I'm so excited that you're here today.
No, thank you for having us.
Yeah, absolutely. Well, I guess we're at her location. So we're actually doing one on location, which I think is super exciting. I just watched her take blood from a kitty, and then you did a urine sample as well too, right?
Yes.
So I thought that was, I got to watch, and the cat was like, "What are you staring at, lady? What are you staring at?"
Live action.
It was live action.
Exciting.
Yes, very exciting.
Good behind the scenes peek.
It was, and I was going to take a picture, but then I didn't ask the patient if we could take pictures and all that kind of stuff, so we didn't do that. But all right, so tell people who you are.
Yeah, absolutely. So my name is Megan Allred. I am a local veterinarian here in Midlothian, Virginia. I've been in this area since I graduated vet school in 2013. I have predominantly been an emergency veterinarian. I did have a 2-year period of time that I worked in general practice, but I've been doing emergency medicine for the remainder of my years in the community. I love emergency medicine. I enjoy the kind of chaos of the day to day. I enjoy the impact, honestly, that we're able to make in emergency medicine, both for patients, for families. There really is something about being there in a patient's most vulnerable time that to me is really rewarding and is really satisfying for helping people. A lot of people will say, I became a vet to help animals, and I can truly say deep down, I love my animals, but I love the people attached to them just as much. And so to me, it's like a win-win.
I love that
type situation.
I love that. So you're here in Midlothian, but you guys just opened. Did your open house. Was that last weekend or
it
the
was
weekend
last
before?
Weekend? Yeah.
Okay. Yeah. Which that was super exciting because we had they had the food truck, which now I can't think of the food truck. Latin Quarter was really
delicious.
Really good.
Yeah.
Their plantains, I was like, oh, can I get some more? And then you had ice cream for the pups as well too, which
cool
was
dogs,
super fun.
ice cream.
Yeah, that was super exciting.
Yes.
So tell me, so you said general practice, and I was like, I didn't realize it's the same thing for humans, right? You can go into general practice or you can go into a specialty.
Yeah,
so
absolutely.
I didn't, when you said that, I was like, oh, that's the same thing as humans. But I don't know why that was weird for me. But let's talk a little bit about why you opened this location. So you did emergency vet, right, too? But so you came from a different place and decided to open your own location.
Absolutely.
Why is that?
Yeah, because I'm a resident of Chesterfield County.
She's going to be on the cover of my magazine, so I'll let you guys know when that comes out too.
I live in Chesterfield County, and I am terrible at commuting, just to be bluntly honest. I was doing a very long commute, and I grew up in a very service-oriented family and giving back to your community. And then just the more I was practicing, it kept coming deep to me of you need to get a practice out here where you live in your community, serve your community. And here we are.
I love that.
So we're excited to be in Chesterfield. Like you mentioned, we just opened in the end of January.
Yep.
The fun snowstorm delayed us quite a bit, but that's okay. We're all better for it.
Right.
And so, here we are. It's been a great 3 months. Chesterfield has shown up. We've been able to help a lot of pets in this community that otherwise would not have been seen and got the care they needed as quickly as they did.
Yeah, I love that. And so they're located, for those of you who do not know where they're located, we're right here off of Hull Street Road, across the street from Walmart, so Hancock Village. There is the Children's Museum. That's probably a good, and Ferguson Lighting, if you want.
Yeah.
They're right there as well too. But so you're in a very, it's a very busy area right here. So this is a great location for you guys to be in. But what exactly is emergent, again, going back to you think of humans and stuff like that, but what is emergent? What would somebody consider to be an emergency for them to
Absolutely.
call you and be like, oh my gosh, I need to go see you versus seeing my regular
Your general
vet?
practice, absolutely. So think of your general practitioner for your preventative care.
Okay.
Right? We need vaccines. We need our monthly heartworm, flea, and tick, which newsflash, pet owners every month, year round. You got it.
Every month, all the time.
Every year. Yes, every year.
Yes.
So that's kind of, we do not offer those services here.
Okay.
Where we come into play is anything that is a sick appointment. So we all know like the urgent care model in the human world, right?
Yeah.
So same sort of concept. So anything from your pet's having ear infection, vomiting, diarrhea. What's going to set us apart here at Urgent Paws, though, is that we will see some more of the severe things. Your patient is having a seizure. Hope you never have to deal with that, but if you do, exactly. You need a place to go, right? If you have a cat that is unable to urinate, so cats get male cats specifically get urinary obstructions, they're unable to urinate.
Oh, I didn't know
Obviously, that's an emergency, but we are equipped to take care of that.
Is that what was happening with the sweet little one?
That cat was just getting a urine sample.
Gotcha.
He's a little bit older. So those sorts of things. We also do surgery here, which is very different from any other urgent care in this area. For instance, Monday we did a foreign body surgery. Last week we took some bladder stones out of a dog that was having more urinary issues. And so we're really going to be urgent care, outpatient, ER. We are here to help. Our primary goal is for your pet to get better quicker. And so when you come to an urgent care, generally your wait times are going to be less than the ERs. There's plenty of things out there that the ER can do that we cannot. And we want to help them so they can focus on those patients and do that. However, there's plenty of things that we do that will get you in and out. You don't have to worry about driving to Short Pump or going to those big ERs. But the other good thing is we do partner with them. So absolutely, there's some things that, like, oh, this looks more serious than any of us, originally realized. And so we partner with them. We get them started. We start that stabilization process, and then we do coordinate getting them there for continued care.
Awesome. When you said foreign object, I assume the dog ate something.
Yes, unfortunately, multiple toys.
Oh,
yeah.
Poor guy.
Yeah.
Because I remember my dog used to eat our socks.
Oh, yes.
And underwear.
Yeah, exactly. I say socks, underwear. Do you know the number one foreign body in dogs?
No.
Just fun trivia. Corn cobs.
Corn cobs?
Yes.
Really?
Yes.
Who gives their dog a corn cob?
I think it's mostly like like they take it out of the trash.
I
don't think it's like people feed it. They generally, most of the time the story is, we had a barbecue
and the dog
grabbed it or got it out of the
trash can.
Yeah.
Okay. Yeah. I do remember my dog has, what do they call it? Counter surfing.
Counter surfing.
Yes. And so she ate 4 ribeye steaks, which, that was super fun, and expensive. And then, but then we also had a dog who loved to eat, and granted we fed them like pork bones. We stopped doing that once we had that
pancreatitis and all that
issues with you learn, you don't know the things, right? But they love to eat those things.
Yes.
And so so let's talk about some of maybe some of the things that people wouldn't think about coming here for.
Absolutely. Skin issues, right? My pet has been itching for months, but this week is a really bad week. Something that we'll commonly see. Snake bites.
Oh, okay.
Yeah, the season has started.
Yeah, it has. Yep.
So copperheads,
babies.
Yes, all those copperheads are out and about. So that would be something that we absolutely can help with.
Okay. How would you know that your dog got bit by a snake?
Oh, absolutely. So generally, it's not actually common that you'll actually see the encounter happen.
Right.
You'll generally just start to see wherever they were bitten. I'm just going to use the paw for an example. You'll start to see the paw is swelling. It's bruising. You might or might not see puncture wounds. A lot of times the fur can kind of hide them. It's not until we shave it we actually see it, but just swelling and lots of bruising. And generally it's extremely painful.
Oh, poor puppies. Does
that
happen often here?
Enough. Yeah. Enough that we carry it in our venom.
Is that a pretty easy, is it a pretty easy fix, for lack of a better word?
No, absolutely. So generally, so basically we control the pain.
Okay. Yeah.
If they're having, there's several criteria that we monitor for how severe is their reaction.
Okay.
With copperheads being the common one, we like check platelets, check their coagulations. If they're high, then we worry about, giving antivenin. If they also can have an allergic reaction to the snake bite itself.
Oh, okay.
And so then that's also when you have to like treat with antivenin and things. But we're very lucky. Most of the time they don't need it.
Okay.
But when they need it, they do.
Okay.
But we're ready if that were to happen. But yeah, it's a common thing that we see.
Okay.
But poor little things. They generally feel great within 24 to 36 hours.
Good.
It's just one of those, man, that first 12 to 24 is pretty
It's pretty rough. Yeah. So you treat cats, obviously, dogs.
Yes.
Any other, I say weird animals? I keep seeing, I don't know if you've seen him, but his name is Jackson, the cockatoo. He's all over TikTok now.
Sweet. No.
But so do you treat any other animals besides those two? Okay.
We do not. We just focus on cats and dogs.
Okay.
That's, exotics would be a great thing to expand.
Yeah.
Because there's not really any, well, I guess there is a primary hospital near here, Brainerd Mill, that will see them. But I think that's about it on this side.
Yeah. I was just thinking about that because, again, this cockatoo who apparently loves to like scream in the middle of the night. So he's like all over the internet.
He's like
so
a little menace.
He is. Like he screams mom in the middle of the night or turns on Alexa. Like, so that he can dance. So I'm just thinking, little cockatoo coming through here. So the surgeries that you guys do, so obviously you do emergency if there's, but do you also do spaying and neutering as well too? Okay.
Yeah, so we don't do any elective procedure.
Okay.
So we don't do an elective spay and elective neuter.
Okay.
There are times that those procedures are emergent.
Okay.
And we will do them obviously if they are emergent.
Right.
I mentioned foreign body, we do that. We do cystotomies, C-sections.
Here they go with the words again.
Cystotomy. Yeah. So make an incision into the bladder.
Gotcha.
To get those, we had a little pup that had bladder stones that kept going into his urethra, and so he was unable to urinate. And so we had to go in and get those stones out.
Gotcha.
For that little guy.
Okay.
C-section.
Okay. How often do those happen?
Yeah, not too commonly. We actually had one about a month and a half ago.
Okay.
Maybe 7 weeks now.
Okay.
Yeah, anyways, those pups just actually went to their forever home. So we got sweet update pictures.
I love that.
We will do we've had some animals that have had masses that were bleeding excessively that, we couldn't stop with medical intervention. And so we will, help the bleeding by removing it.
Gotcha.
So things like that.
Okay.
But things that you can, obviously we can take care of, get those little pups feeling better.
I love that.
Yeah.
So why did you go into veterinary medicine?
Yeah. So interesting. Veterinary medicine was not my plan.
Okay.
I actually went to school to become a marine biologist.
Okay.
I have always loved conservation. I fell in love with sea turtles in college. I took a couple of marine biology classes, worked at a rehabilitation center, went to Costa Rica, did research for a summer.
Oh, wow.
Lots of fun things. I had elected to go get my PhD in marine biology.
Okay.
Kind of more I was looking into it. It's like, man, that's a lot of sitting behind a desk, writing grants.
Oh, okay.
Don't know if that's for me.
Yeah.
You'll learn pretty quickly being around me. Sitting still in one area is not something I'm good at.
Right. That's your forte.
Sometimes strapped down to write records.
Right.
So I was like, back to the drawing boards.
Okay.
And so I kind of thought back, well, I really love, what can I still do? And I remembered how much I loved the medical side of taking care of the turtles.
Okay.
So I quit my job as a customer service manager. I was a customer service manager at Harris Teeter grocery store through college. And I quit my job, went and got a job as a kennel attendant in a veterinary hospital. I was like, I'm going to give this a go.
Okay.
And haven't looked back.
I love that.
She was a great vet that pushed me to explore all parts of veterinary medicine. Her husband actually owned an emergency specialty hospital.
Okay.
And she called me up one day. I was like, hey, he's short a person. I told him I was going to call you to see if you could come fill in. And I haven't looked back from emergency medicine since.
I
filled in one case or one shift in the ER and then have been in ER ever since.
So what was that case? Do you remember?
It was just a shift.
Gotcha.
I do remember that one. So the way that hospital worked is when you were working, you were either outpatient or you were with the ICU patients.
Gotcha.
I was in ICU care. We had a couple bad pancreatitis dogs. I do remember those patients specifically.
Gotcha.
really sick diabetic that was like on a bunch of insulin pumps and things like
Oh.
that. So it was a true introduction to ICU care, and I loved it. It was
Yeah.
great.
Again, you don't think about, like, I mean, dogs basically have, or like animals basically have the same conditions
Yeah,
that, like,
very similar.
humans.
Yeah.
You know,
Absolutely.
cancer, diabetes, like all of the things, and you just don't. You know, I guess I don't know. I just never think about that.
Yeah. No, it's very common.
Yeah.
And then it's something else that, there's also lots of meds that we use back and forth between human and pets.
Okay.
Yeah.
So I'll tell you I would say funny story. So when we used to live in Italy, that's where I'm from, right? And so we had a puppy, Bella. It was I can't remember what type of dog she was, but she was really, really sick when she was little. And so my mom had taken her to the vet, and I remember whatever the medicine was extremely expensive to get in the vet side. But it was the exact same medication, human. And so in Italy, healthcare is free.
Oh,
and so we had actually gone to the doctor's office, and my mom was trying to get the medicine or whatever. I'm totally sorry, Mom. I'm like totally telling on her right now, but I don't think she can get prosecuted. That was like 30 years ago. But she went to the doctor and was, say whatever. And the doctor, because I think she used that I was the one who was sick.
Oh,
and so the doctor asked me, and I'm like, no, I'm fine. It's for my dog.
Oh, and the doctor
was like, yeah, I can't give you this.
Yeah.
And my mom was like, but it's the same medicine. He's like, it's not. Yes, it is the same medicine, but it's not the same.
He's
thing.
not legally.
He's not legally allowed to do that. And you give this dose to a human, this dose to a dog, whatever. And I remember we walked out of there, and I was crying because my dog was so sick, and I was like, I'm so sorry, Mommy.
Right.
And she was like, it's okay. She was still to this day, I feel terrible.
Right.
So anyways. I haven't thought about that story in a really long time. I have to remind my mom about that. Anyway, circle it back. So, okay, so you guys are located. Tell people your phone number and your website address.
Yeah, absolutely. So our telephone number is 804-280-6611.
Taxing your brain.
Yeah, you are. Our web address is urgentpawsvetcare.com.
With an S.
Yes.
Paws Vet Care. Okay.
Yeah. We're also on social media.
Yes.
So Instagram, Facebook. You can even find us on TikTok.
I love it.
Yes, this crew loves to do some fun things.
Okay.
You'll catch them here before and after their shift making some fun videos.
Love that.
So it's a lot of fun.
That's fantastic. Okay.
Sometimes they rope others into them. So you never know who's going to be a guest appearance.
If you ever need me.
Gotcha.
Apparently, I love being in front of a camera.
Okay, great.
Even though I did a photo shoot on Monday, and I was just trying to, just because people don't know what I do.
Yeah.
And so I was, talking about it or whatever. And like every 3 seconds, I'm like, she's like, you talk about this all the time. I'm like, yes, but when it's like one-on-one, it's totally fine. You put a camera in front of me, and all of a sudden I turn into Jack Nicholson from The Shining. Like it's just weird. It's weird. But anyways, that's okay. Okay, so you guys are here. You're located again off of Hull Street. Brand new, just started in January. Yeah. But you guys have been steady, which is fantastic. What are your hours so that people can know?
So we're here Monday through Saturday, 11 a.m. to 8 p.m.
Okay. Yeah. So what happens when there's like an emergency in the middle of the night? Then what do they do?
Absolutely. So that's where you do need to reach out to some of the emergency hospitals around. Most of them are in Short Pump at the intersection of 288 and 64.
Okay.
So kind of closer to the Goochland area. There's 3 in about 2 mile radius.
Okay.
But those are the ones that are going to be open overnight.
Okay.
Always, anytime you have a pet emergency, call before you go.
Smart.
There's been a crisis kind of in the veterinary world that's been going on for a while of mental health and staffing and things like that. And so, no fault of any of the hospitals. Sometimes they don't have the staff to be open for the night or to take on any patients, which, we need to respect that they're setting boundaries to take great care of the patients that are there, but also don't want clients just driving all over Richmond trying to find care. Pick up the phone, call. Generally, if they're on diversion, meaning patients need to go elsewhere, they'll kind of say, hey, have you tried so-and-so?
Okay.
If they're aware of who's happening.
Okay. Yeah. Perfect. Awesome. All right. So one last question before we go. So obviously you love being a vet, right?
Absolutely.
And love doing emergency, but why open your own location? Why do that? I know you hit on it a little bit more like at the beginning, but.
Yeah. So I have always seen and it's veterinary medicine kind of across the board. Culture in veterinary hospitals has always, I shouldn't say always, because there's those angels and the gems out there. But overall, it's not known to be good. Okay. It's not known to be a supportive environment.
Gotcha.
It's not always known to be a positive environment.
Okay.
And what we do is not easy.
Yeah.
You know, I'll be the first person to say, like, you know, there's days where, man, you second guess, like, why did I choose to put myself through this? You know, for my, but I've always felt like, you know, I can't change the world, but I can change right here.
Yeah, absolutely.
I can change my four walls.
Yeah.
I can, you know, I will be the person to say I'm not perfect,
Mhm.
right? But I try to create an environment of learning, an environment of support, of patient-centered care. And so, you know, as a team, we make team decisions. Very first thing we say is this improving our patient care? Is this going to improve the life of a patient? Okay. If the answer to that is yes, then great. We move on to question 2. Does this improve the life of our team? And then if the answer to that is yes, then we move forward with doing things. But we try to focus on not only our patients, but our team. The other fun thing is veterinary medicine has become very corporately owned. Private practice for veterinary medicine is becoming few and far between. But with that becomes employees start to feel like numbers. They don't start to feel they're not valued. They don't feel like, you know, they're really part of the team. They just feel like they're, you know, told what to do from high above. And so that's why, you know, we have our small, close-knit team that we're trying to change that stigma.
Yeah.
Even if it's just right here in Midlothian, we're fine with that.
Yeah.
But we've got a great thing going.
I love that. Well, I think of like the pebble in the lake or whatever, right?
Yeah.
You drop it and then it creates this ripple effect,
Yep,
right?
exactly.
And so yes, you may only be affecting just this area, but it really truly does, because that energy, you know, flows out.
Oh, absolutely.
So what would you say to somebody who is twofold, looking to go into vet medicine?
Oh, absolutely. Yeah.
And then somebody who's looking to open their own business?
Yeah. Okay. Absolutely. So if you're looking to go into veterinary medicine, do your homework, right? So I would encourage you to shadow as much as you can. And you can get into veterinary medicine on so many different levels. It doesn't mean you have to be a veterinarian.
Okay.
You could be a veterinary assistant, a licensed veterinary technician, a receptionist. If you're good at, you know, office type stuff, there are business management parts of this. So there's lots of facets that you can do, but do your homework to kind of understand what each role encompasses, and then go shadow.
Okay.
Go do it.
Yes.
I would never be who I was if my boss didn't push me to go work that ER shift, because I was nervous. I was scared. I was like, you mean I can go work on the ER floor? I've been working general practice at that point, it was only been a couple of months.
Right. Yeah.
But really expose yourself to a lot, because you never quite know what your niche is going to be.
Correct.
Could be emergency, could be general practice. It could be specialty.
Right.
We're blessed. There's a lot of specialists in our area, all the way from ophthalmology to dentistry to surgery to neuro.
Yeah.
So yeah, just go out there and really explore. Have the tough conversations with the people that work there.
Okay.
What do they love? What do they hate?
Yeah.
What's the hardest part of their job? You know, put yourself in those shoes.
Yeah. I love that.
Yeah.
Where did you go to vet school?
Auburn,
Okay.
down in Alabama.
Alabama.
Yeah.
I love that.
Yeah.
I love that. Okay. Yeah.
So someone looking to own their own business?
Yes.
Absolutely. So I would just encourage you, do it. Okay. Make a plan and do it. Don't let, you know, people tell you can't.
Yeah.
Put your head down. Put yourself with good people.
Yes.
Find good people, good support. And you know, learn from those people. You can't be great at everything.
Yes.
Find a good marketing group. Find a good financial group. Find even people within your profession that have done it before that can be your mentors.
Yeah. I love that.
I have a mentor that's owns an ER practice in Texas. You know, there's several local women that own veterinary hospitals right here in the Richmond area that, you know, I look up to as mentors. And so when you kind of have that little community around you, it's a good thing.
Yeah.
But yeah, just do it.
I love that.
Yeah.
And I'm a huge fan of learning from other people and realizing like my zone of genius, and it's okay. It can be hard especially when you're opening a new business of getting the marketing person and getting the financial and getting this. And you're like, I know, but I just opened, but that's what they're good at.
Yes.
You're good at taking care of the pets.
Yes.
Right. And so if you're doing all of these other things, I think that's where again, I always talk about this. I should start getting royalties. The who, not the how. There's a book that talks specifically about that. But somebody goes into business and the story is because she loves to bake.
Oh,
and so now all of a sudden she opens this bakery, it's a brick and mortar, and then she realizes she's not just the baker anymore.
Right.
She's the person who does the cleaning. She does the HR. She does the payroll. She does all of the procurements. She does marketing, like all of these things. And really all she wanted to do was bake.
Just bake.
Right. And so when do you pull the trigger on doing and was partnering and surrounding yourself with the people so that you can go and then do what you're really good at?
Yeah, absolutely.
Right. So I
would say early,
advice.
Right?
As early as possible.
Yeah,
as early as possible.
And I can tell you kind of what I did was I ranked, because I kind of knew, okay, I need marketing, I need this financial, this, that. I ranked like, okay, what are the things that tough love on yourself? What are you actually good at? You might think you're good. What are you actually good at? And the things that I was like, okay, for instance, QuickBooks. Like I'm pretty good at doing QuickBooks, right? Okay. So I knew that I didn't need a bookkeeper right away. That's something I could maybe wait on.
Yes.
But marketing and stuff like that, I was like, nope, I need help right away. And so those were kind of priorities for me because let's be real, when you open a business, your finances are not all there.
No.
If they are great, then hey, bring them on day one.
Yeah,
enjoy it.
Right.
But they're, if they're not, then, really look at like, who's going to help you really launch and be the most help. There's also, help with that headache.
Yes.
You need to enjoy it, right? You need to enjoy the ride. You need to enjoy and celebrate your accomplishments because starting your own business is something that is a big thing.
It is a big thing.
And so you definitely need to celebrate yourself.
Exactly.
So find those people around you.
I love that, who celebrate that.
Yeah, exactly.
Fantastic. Okay, one more time. We didn't do this earlier. So address, phone number, and then website.
Awesome. So Urgent Paws Veterinary Care is located at 6645 Lake Harbor Drive in Midlothian off Whole Street, kind of think Winter Park type area. Our web address is urgentpawsvetcare.com and
phone number.
804-280-6611.
Awesome. Yes. So I will link their information down below, their website and their phone number. So if you need them, definitely come see Dr. Megan and her team. They are fantastic, and every single one of your team loves what they do, and you can feel that when you walk in the door. So
that's her goal.
I love it. So awesome. Well, thank you again, you guys, for watching. Thank you for being here, and as always, stay fluid, my friends. I'm always cheering for you. Have a great day, everybody. Bye.